Nurse, we have a medical emergency in room 3. What's the situation?
Doctor, the patient in room 3 is experiencing severe chest pain, shortness of breath, and dizziness. Their blood pressure is dropping rapidly, and they are pale and diaphoretic.
Alright, let's gather some more information. Have they had any history of heart problems or any recent surgeries?
According to their medical records, they have a history of hypertension and underwent a coronary artery bypass graft surgery 6 months ago. They are also taking antihypertensive medication.
Given their symptoms and medical history, it seems like a potential cardiac event. Please ensure we have an EKG machine ready in room 3. Start an IV line with a saline lock, and draw blood for cardiac enzymes and a complete blood count.
Understood, Doctor. I will prepare the EKG machine and gather the necessary equipment for the IV line and blood draw. Should I also administer oxygen while we wait for further instructions?
Yes, initiate oxygen therapy with a nasal cannula at 2 to 4 liters per minute. Monitor the patient's oxygen saturation levels closely, and provide supplemental oxygen as needed.
Oxygen therapy with a nasal cannula at 2 to 4 liters per minute, noted. I'll also place the patient on a cardiac monitor to continuously monitor their heart rate and rhythm.
Good. Once the EKG is ready, let me know the results immediately. In the meantime, document the patient's vital signs, including blood pressure, heart rate, respiratory rate, and oxygen saturation, at regular intervals.
Absolutely, Doctor. I'll keep a close eye on the patient's vital signs, and record them regularly. I'll also ensure proper documentation of all interventions and observations.
Great. Let's also inform the cardiac team and prepare the cath lab for a potential intervention. Notify the cardiologist on call, and let them know we have a patient in possible cardiac distress.
Will do, Doctor. I'll contact the cardiac team and inform them about the situation. I'll also notify the cardiologist on call and provide them with all the necessary details.
Excellent. While we wait for the cardiologist to arrive, keep the patient as comfortable as possible, and continue to monitor their vital signs closely. Let's be prepared for any sudden changes in their condition.
I'll ensure the patient's comfort and closely monitor their vital signs. I'll stay by their side, and provide reassurance throughout the process. Please update me on any changes in the patient's condition or further instructions.
Absolutely, nurse. We're a team, and your assistance is vital in this critical situation. Let's work together to provide the best care possible for the patient. I appreciate your prompt actions and attention to detail.
Thank you, Doctor. I'm here to support you and provide the best care for the patient. I'll stay vigilant and ready for any further instructions. Together, we'll ensure the patient receives the immediate care they need.
That's the spirit, nurse. Let's continue to work efficiently and effectively. I have faith in our teamwork and expertise. I'll update you as soon as we have any new information or instructions.
Understood, Doctor. I'll remain alert and ready for updates. Let's provide the best possible care and give this patient the best chance of recovery.